And I'm now going to introduce Professor Mahmood Adil, who is the Medical Director at NHS National Services Scotland.
Thank you, Paul, and very good afternoon. I think the challenges we are facing now and the next many years to come, which my previous speakers already alluded to, it means that we need to change the narrative of technology. It means that rather than technology-enabled care, we should be saying technology-enabled value-based care. So the value is that how best we can achieve the outcome with the resources we have got in hand. So over the years, while working in the NHS, the word quality has been very, very clear to me. It means three things: safety, effectiveness, and patient experience. So it means the industry need to be very clear that whatever we are trying to develop our business models, they need to achieve those three outcomes. And I think if we are unable to achieve those outcomes, then it means that we are not achieving value. I think there's always a challenge that when we talk about quality, there are two types of quality. One is the service quality. It means that the person is arriving at the patient's doorstep on time. But will it make a difference in patient outcome? We don't know. The other is the health quality. It means the person's physical, mental, and social well-being has improved. So talking about quality and the resources, the data become paramount. So it means that we do collect a lot of data, both in health and care system, but we are unable to change into applied intelligence, which can lead to achieve the outcomes I've already alluded to. So I always say that over the years, I, being a doctor, changed from stethoscope to datascope. It means the tools I used to use to improve the individual patient outcomes, now I'm able to use different tools in my leadership role so that I can touch the lives of 5.3 million people in Scotland. So it means over the years, there are certain things are shifting. And I think the industry and we all, the part of the health and care system, need to understand about those shifts. It means that from patient to population, so Paul alluded very clearly in the morning about the population health management. Second, from healthcare to well-being is a big shift. So it means that we have to work to co-produce health and well-being rather than we should be just working at our own. And third is from cost to resources. Because when we talk about cost, it means we think what pounds we have. But when we talk about resources, we need to start thinking about 8.8 million carers. We can start thinking about a number of other resources we have got in hand. And we need to think very innovatively, like Jeremy said, that how innovative they are to bring the new ideas on board. And the shift from data to applied intelligence, that is, in a way, my day job. I always feel that this should be the movement we need to be thinking from data to applied intelligence. And NHS is data-rich and intelligence poor. It doesn't mean that the people are working on it, they are not doing the right job. But when we collect the data, we sometimes don't understand that piece of data, how it is going to have an impact on the outcome. And that means we need to be very clear from the outset. And second, we should be providing that applied intelligence to the frontline staff so that they can improve the outcome. And that brings me to the point that is our workforce is ready to adapt to data a challenge and to understand and use the data and technologies available. So it means that the curriculum and the training of our workforce needs to be changing. So I'm working very closely with all the Royal Colleges so that the future medical and clinical workforce should be able to utilize the data and technology in the best possible way. Just to conclude, and we can have more discussion and questions later on, that each one of you sitting over here, you are touching the lives of millions of people. But we need to be thinking very clearly that can we be more effective, more efficient, and that is where technology comes into play. Thank you.